Welcome back. I'm Gail Trauco, and this is Healthcare 911, where we talk all things health. Today, we're continuing our discussion on bariatric surgery with Dr. Christine Ren-Fielding and Dr. George Fielding, bariatric surgery at NYU. I want to talk about some of the myths and misconceptions about bariatric surgery. What would you say is the most common misconception about bariatric surgery?
I think the most common misconception is that it's an easy way out. There's a lot of pressure on people to be able to do it on their own. And there's not a shred of data to support that someone who is morbidly obese can do it on their own and keep the weight off. So that's, to me, the biggest myth.
Well, we were talking about pros and cons earlier of the surgeries. What are some of the pros and cons of the procedures and the patient successes, like gastric bypasses versus gastric sleeve? Who's going to lose more weight?
Well, what we're talking about is morbidly obese people. We're not talking about people who need to lose 10, 20 pounds, even 30 pounds. These are people who are losing 50, 75, 100, or 200 pounds. And as we spoke before, the offending difficulty of losing weight when you're severely overweight is hunger and not feeling full. And there's no question that every operation out there is how they work. The gastric bypass, the sleeve gastrectomy, and the lap band surgery all work by cutting down on your appetite, making you less hungry. They also make you less full, or more full with less food. And so you then have to decide which operation may be beneficial for your medical conditions, or the amount of weight that you have to lose, or where do you live. And we can go into that in a little bit.
Well, I'm a lap band patient, and I've had 2 slips with my band. What is the failure rate of a lap band patient? You know, are they going to keep the weight off? I have. And what are any of the complications that may come post-operatively that the patients may see?
So the failure rate is somewhere, if you add up all the various things, somewhere between 5 and 10% of people are going to be just, I can't do this anymore. There's about another 10%, 15% who do okay, but not stellar. The rest do great. And it comes down to, there are various aspects about the band, and the most common complication, as you mentioned, is the slipping. Where the stomach comes through the band, it gets stuck, you get acid reflux, and it's miserable. It's not a life-threatening complication, but it's awful. I think that's the biggest issue with the band.
Well, is it true people are having their lap bands removed today?
It is true, because I think there's a feeling that I've stopped losing weight, I've plateaued, and I can't lose any more weight. And instead of trying to work with the lap band to try to adjust it, to tighten it, to take away hunger, then surgeons, patients say, well, let's just take it out and do something differently. There's also an important facet that any operation you have, you still have to do the old school stuff. You still have to eat healthy, avoid snacks, avoid sugar, exercise. No one says that surgery is a replacement for healthy living. That's in conjunction with it. So I think that there's a lot of misunderstanding about when a lap band should be removed or not.
But I think there's an absolute myth that they should be removed, that there's like a timeline on it. And we're starting to hear this stuff in our practice. People coming back, they've had a band for 10 years, they're doing awesome. And someone in the bar said, oh, you've had it 10 years, it's got to come out. Well, that's just nonsense.
How many doctors in the U.S. are doing lap bands today? I know you have to be a certified lap band surgeon and have done so many bands to receive that certification. How many lap band surgeons are there in the U.S.?
There's still several hundred surgeons that are performing lap band surgery, but I think it's very important that a person who's interested in having lap band surgery needs to go to a surgeon who has a program who will not only perform the surgery properly, but then take care of the lap band and the patient, because that's the downside of the lap band, is that it needs a lot of post-operative management. The band needs to be tightened, and that's done in the office with a very small needle, which takes several minutes. But it does require monthly visits in the first year or so.
And it's a two-way street. If the patient doesn't turn up to get the band adjusted and the doctor looking after them doesn't adjust it, the band will not work.
How about age range? What's the lowest age for a patient that can receive a lap band? Is it available to teens and young adults?
Well, the labeling on the device says a person has to be 18 years or over. However, there are many institutions, including ourselves, that will operate on someone as young as 14, maybe 13 years of age. But those teenagers are evaluated thoroughly.
Stay tuned to Healthcare 911, where we cover life-changing information.